Hello everyone, welcome to another Fresh Dental Shadowing session. Today with us we have Dr. Simi Dhillon. She's a general dentist and she'll be sharing her experience with us. So Dr. Dhillon, whenever you're ready, you may begin.
Thank you, Carolina. Thank you for this opportunity to the virtual shadowing. I think this is a great thing that you guys are doing. I have never done this before, so this is my first time. So we'll go through some of the stuff that I've prepared for you, and then it looks like in the end there will be some time to do some Q&As. So to start with, I'll just introduce myself. My name is Dr. Simi Dhillon. Most of my patients, they call me Simi. I am a DDS, so and I work at Caribou Dental Clinic in Williams Lake. It's in British Columbia in Canada. It's a small town, and I've been practicing there for almost 9 years now. That is me. So what will be discussed today is just a brief journey from India to Canada. Also the application process for international dentists. So today, most of the stuff will be for international dentists. So I think that will help the international dentists quite a bit. And then how is it coming over here to Canada or US from a different country, and then practicing dentistry here, how it's different here. Also, we'll discuss some of the stuff about working for private versus corporate dentistry. What is the difference? And then we'll just go over the typical day as a dentist, and then general dentistry versus specializing. So we'll talk a bit about that too. All right. So first I'll talk a bit about my education. I did my first dental degree, and that was BDS, and I did it from India. I did it from Punjab in India, to be specific, and it's Bachelor of Dental Surgery. So it's basically a 5-year dental program, and then in India you go into a dental program or a medical program right after grade 12. So you're quite young when you start your dental degree or your medical degree. So I did that for 5 years, and that includes 1 year of residency. It's called internship in India. And right after that, I didn't have any experience in India. I didn't get to practice in India. We just moved to Canada. And then I started working in Canada. I started, some odd jobs. I've worked many odd jobs. I've worked at 7-Elevens, I've worked at hotels, I've done housekeeping, and just, anything that you can imagine. And then I worked at a dental office, and then I did dental receptionist there. So when I was working as a dental receptionist at a dental office is when I realized that I have to go back into dentistry, and I have to, that is enough. So then that is when I started applying to the programs. Because I was in Vancouver, so it was very close to US, and I really had, I had researched quite a few schools in US, and I was really interested in this program at UW, at University of Washington, School of Dentistry in Seattle. So I really, from the start of my application process, that was my my top school. Although, I was open to be at any school. So I started that application process it's called IDDS program in University of Washington. It is a 2.5 years program, and it's full-time. You go there daily. So in order for my application process, I started shadowing at a lot of local dentists where I was living. And then, as I said, I worked as a dental receptionist. So I kind of got an idea how the dental offices work here. Because, as I said, I was just fresh out of dental school in India, and I didn't have any experience as a dentist in India. So that's what I did. So we'll talk a bit about the application phase. For now, I to start for the international dentist, you have to get registered on CAPIT, and it is, you start your application there. Usually there's an application fee for that, around 150 to 200. And then what you need for that is, you need to get a really good personal statement, and then some dental experience. Coming from a dental school gives you some dental experience. Doing internship gives you some dental experience. And then, as I said, I started shadowing and volunteering at lots of dental offices where I was living. So that gave me some dental experience. You also need your transcripts evaluated, and then you need to get NBDE, Part 1 and Part 2 both. Another requirement for international dentists is English, because obviously, we're not from English-speaking countries, so it is important to communicate with the patients here and with everyone. So they do require the TOEFL score, and then of course you need your letters of recommendation and then your resume. Out of all of these, what I think the most important would be your personal statement, because that is, your scores are one thing, and then your scores on English, and it's one thing, but personal statement is kind of your personal connection with who you are, because that is how, the interviewers, the dental schools will look at you, and they'll look at the personal statement, and that kind of sets you apart from the from so many applicants. So what I would suggest for personal statement is, obviously you write all your accomplishments over the years, and one main thing is what sets you apart from the others. It can be something academic, or it can be something, just extracurricular, like, for me, I was really interested in sports. So that kind of, it kind of sets you apart, and why you chose dentistry. For all of us applying, we are in healthcare, so one of our main thing to apply to any healthcare profession is, obviously we like to help people and we like to serve. So if you have any experience in that, any volunteering that you have done over the past, so include everything on your personal statement. But the first few lines of the personal statements, they are very important, because if you just start with I am this, and just say something about you that tells you that you are different from others. So that's what I would recommend. So the application phase, it does take quite a lot. And then for getting into school, tips for getting into a dental school, as I said, the first thing that you have to do is to believe in yourself. And then once you know that this is what you are doing, then you just follow your path, and you just keep doing one thing a day. You don't have to do everything the same day, that all of your experience in shadowing. You just keep moving towards it. Don't lose hope. Get lots of experience shadowing, volunteering, as I already talked about, and in your application include everything that makes you, because you never know what might interest the interviewers. I'll just tell you one example. When I was interviewed at University of Washington in Seattle, my mom was back in India. So she had sent me a big parcel, and she wanted me to take it with me to the interview. And in that parcel was all of the certificates that I had accomplished over the years since kindergarten. And trust me, there were lots. And I was like, no, Mom, I'm not going to bring that big parcel with me. It had, my certificates, it had my report cards. Academically, I was a really good student, and I think in India you have to be, because otherwise you get lost in that big population. So, and it had lots of trophies I had won for different things, for mostly for school, mostly for getting high scores. Some were for writing competitions, some were for essay writing, for speaking. So there was this big parcel, and I did take it with me, but I kind of hid it. And then the interview was, it went good. They asked me everything, and then I was about to leave. And I took the parcel with me because I was just kind of embarrassed to show them this big parcel. And then just I was about to leave the door, I was like, okay, what if this was one last thing that, that I will do, and that will make me go into this school. I'm like, okay, I came back, and they're like, oh, you're back, what happened? I'm like, I have to show you something. So I opened this parcel, started taking out my certificate, my trophies, and they were first they laughed, and they were like, you should thank your mom, because this is what, this is what sets you apart. So that was one thing. I'm pretty sure there were other things that made me go into that school too, but I think that was part of it. So something that I thought, that they would not have interest in. Why would they want to see my report cards when I was little? So anyways, that was a long story. But anything that you have, that you have done in your life, include that, and then try to be yourself. If you try to be fake, if you try to pretend something that you're not, then you will get caught, and the other person can tell. So try to be who you are. Being authentic, it will get their attention. Another thing was getting a good score on the English test, and I practiced a lot on that. And I think that's really important for international dentists, because again, as I said, we come from non-English speaking countries, so it's not ingrained in us. So practicing a lot. I watched a lot of YouTube videos. The TOEFL, they have their own practice tests and stuff, so go through that, do all of that. What I also did was I started working at a call center. It was like an emergency call center for after hours, all kinds of businesses. So there I got lots of practice, practicing my English, and just kind of communicating with people, and communicating over the phone. So that is what helped me. Another thing is always, be on the lookout for the opportunities. So, before I got into school, we had this big dental kind of seminar in our city. So, I went there, and there were like lots of dentists there. So I got to talk to them and see how the dental practices work. Just staying connected to the dentistry, because if this is what you're going to do, you need to know what you're getting into. So networking is really important. And what with these virtual shadows that you guys are doing, this is really awesome for new students, because I was going through your videos, and there's so many dentists and their experiences, and this is such a great thing you guys are doing. So kudos to you. And keep improving yourself. Don't just think that, oh, I've got my scores, then I've got this one shadowing done, and then that's it, because there's never an end to what you can in your resume. The more you have, and the more you have is good for you as well, so what you're getting into. And again, believe in yourself, never lose hope, because when you believe in yourself, it kind of, the power of manifestation is true. So when you believe in yourself and you think positive things will happen. So that is, my tips. And I'll get to your, when we get to Q&A, if you have any other questions, we'll get to more of that as well. Specialization versus being a general dentist. I always wanted to be general dentist because I just love everything about dentistry. I cannot do extractions all day long, or I cannot do root canals all day long. When you're a general dentist, you get to work everything. You do crowns, bridges, fillings, you do exams, and then you get to do root canals and that stuff. You're not confined to just one thing. So that was my one main thing, because I just wanted to do everything, and not just limit myself to just one thing. Even when you're a general dentist, you can focus on one thing, because I've seen many practices, they're general dentists, but they call themselves cosmetic dentists. You just cannot call yourself like root canal specialist or endodontist if you love doing root canals, but you can focus on root canals, and then you can call your practice root canal focused practice. And one thing that happens, I remember when I was in dental school, I loved doing root canals, and for a while I thought, maybe being endodontist is, not a bad idea. But then when I came out of school, I just, started working. And then later on, I realized that now I like restorative more than I like root canals. So you change, it changes when you're starting to practice. In the real life, things change. School life is quite different than real dentistry. So what you think that you like during dental school, you might actually not like it. Another thing that I would recommend, and what I didn't do, was GPR. GPR gives you so much real life experience before you go into real world. I would recommend, if you can, to get the GPR, to get that 1-year residency. I was really interested in it, but my circumstances at that time were that, I was done with school. I had done school in India, then I had spent 5-6 years doing nothing, and then I did this 2.5 years. So, I just didn't have that much time. And then, I was at a point where I wanted to start working. But that is what I would change for myself, and I would recommend is really good doing a GPR. So my practice, my first job was, and till now is my only job. I work in a very small town in British Columbia in Canada. I moved to Canada after my school, because that is where I was from. And then I didn't put it in these slides, but after you're done with the school in US, and if you have to come to practice in Canada, you have to pass another test. You have to give license exam in Canada, which is if you went to a school in US, it is not that hard, but still it's called NBDE, and then you just pass that exam. It's written part, and then there is a clinical part. But mind you that I did it almost 9 years ago, so I'm pretty sure that it's still the same, but there might be some changes. So yeah, I did that. So yeah, I came to a really small town in British Columbia. So it's kind of a rural practice. It's not in a big city. We have one Walmart and then a couple grocery stores. So, it is a very small town. The reason I chose that was I wanted to start practice where I would get the most experience. Another thing for me was I did not want to do hygiene, and most of the jobs that I was getting in big cities was where I had to do hygiene and everything. And the patient load is more in rural, and you get more experience. My idea was to just be in this town for about 1 or 2 years to get experience, just like you would get in a GPR, and then move to a different city, a big city. But I started this job, and I have been loving it where I am. People appreciate you, and then also I don't think that if I was working in a big city, I would get the experience of working, and I do everything there. you get to just practice dentistry. And that's why I liked being in a small town. So coming to private versus corporate dentistry. So where I'm working, we started as private clinic. It was owned by one dentist. I was not the owner. I have been an associate for the last 9 years. So it started as a private, and then in the last few years, it eventually changed to part corporate. That means where, it's still, some of it is still private, and then major part of the clinic is corporate. When I started my job, I didn't want to go to corporate dentistry because I had heard not good things about corporate dentistry. I had heard they focus more on the numbers and they don't focus on patient care. For me personally, the main reason why we become dentists or doctors or nurses is because we do really care about people. We do really care about patients. And I had heard, as I said, not good things about corporate dentistry. So that's why I chose a private clinic. And then as we kind of changed to corporate dentistry, I started seeing that, being in a corporation is not that bad. It's basically we'll talk more about the private and corporate in my next slide, but, it kind of changed my thinking, and that is the only reason I still stayed here. Because if for a single moment I'd realized that it's all about numbers and it's all about, there's no patient care, I would have left. So before we talk more about private and corporate, I'll just talk about when you choose a practice, where you want to practice, what clinic you want to practice. I really, really recommend that you spend some days in that city. You spend, you look around, because that's where you'll be staying for the next, 2-3 years or forever, or for, working interviews are great. I did that. So, you get to know the people around you. You get to know the staff. You get to know the dentist, because seeing someone for a couple hours for an interview is just not enough where you have to spend, most of your day. Spend lots of time with the owner, with the staff that you'll be working with. See if you're you match with those people, because not everyone is going to be compatible with you. So that is really important. One thing that I didn't do, but I highly recommend doing now, is to get a 3-month trial period in your contract. So whenever you go for a job, you do sign a contract with them for 2 years, 3 years. But what after a while that you hate it, and then you're stuck for 3 years? So get like a 3 to 6 month trial period to see how you like it. And another thing, if you want something in your contract, put that in writing. It is really important, and I learned it the hard way. Do not just tell them, can I have this too? And then if they say, oh yeah, when it's time, you'll be fine. We'll do this for you. If you want something, put that in writing. And the contracts they are in English, but they are not easy to read. You mostly don't, there's so many legal terms in the contracts. So make sure you kind of go over with that contract with someone who really knows the dental terms and who really knows what contracts. A lawyer will be a good person. Make sure you have that. And then negotiate. Listen, when I came out of dental school, when anyone comes out of dental school, we're like, whatever they give us, we're happy with that, because we don't know our worth. You are very worthy. So make sure if you want something, negotiate. You negotiate and then you'll get it. You just have to be at that right practice. And if you want something and then the other person is just not even, bending a little bit, then maybe you're not a good match with that dental practice. So make sure you're comfortable with the contract, make sure you're comfortable with the staff, with the working environment, because you will be stuck there. And if you hate it, this will be very bad for your mental health, for your physical health. So that is what I would recommend when you join a practice or want to work at a clinic. So yeah, this is what we were talking about, private versus corporate. As I said, we started private and then we went corporate. So every corporation is different. Now, I'm not very sure about corporations in US. I can only say about Canada, and I can only talk about my own corporation that I'm working with, which is 123 Dentists. Every corporation is different, and it also varies what you perceive, how you perceive things, and with that, I mean, if you want to look at the positive side of the things, or you see what's just negative. If you look at corporations, you have to see what you're getting in return as well. I personally feel, after working with this corporation for some time, is that corporations can be quite good for new graduates and for new dentists, even the practice owners, where the corporation, you're working within a corporation, because then as a dentist, you only have to worry about clinical aspect and you only have to worry about your patients. Where I'm working, the practice owners or the management is still responsible for, treatment options for patients, what we're buying for the clinic, for the hiring and firing of the staff, for the clinical protocols. So corporation is not interfering too much with, daily, day-to-day life of us. What they're responsible mostly is like bookkeeping, accounting, payroll, and the general office management, but not the clinical aspect of the management. So I feel that is less stress for the dentist. I also feel with the corporate dentistry, you do get access to high quality dental care, because to the high quality gadgets that you get in your clinic, because corporates, they are they have a huge network, so you can they have access to so many things that they get things at discounted rate. Also, you get a lot of access to CE courses, is what, every month they send out a big CE course, and then we do need CE points as well, every year or 2 years, depending on where you're living. And as I said, corporate dentistry also, it offers more readily available resources for you, because of just their huge network. So that is my point of view, and that is what my corporation is, where I'm working. But obviously there's so many different corporations, and US is a bit different than Canada. So you just have to, do your research before you decide if you want to do private versus corporate. You just have to do your research, and then, talk to the dentists who are working in that corporation, because everyone wants to help, because everyone was at your place, at your spot one time. So, just talk to people and see if this is the right fit for you. That is very important. As I keep saying over and over, you have to find the right fit. Do not just fall for any job. Do not fall for the first job that you get out of dental school. You have to find the right fit. Otherwise, it will be, it is 2 or 3 years of torture if you're working somewhere that you don't like, after you've spent so much money on yourself, after you've spent so much time, you deserve a job where you are happy, and where you feel like in the morning you feel like going, and at the end of the day it doesn't really feel like a job. So that is really important. So we'll go over the typical day as a dentist, and that is for a general dentist. Again, it depends on the number of patients that you have. As I said, I work in a small town, so we're always very busy. Typically in my practice, 15 to 20, and that is like average. I have, I remember the days I used to see 30, 35 patients in a day, and that was pre-COVID. COVID kind of put a little bit things slower. It got things slower a bit, but still, I see 15 to 20 patients per day. What our morning always starts with the morning meeting, and that is, we call it huddle, where that is kind of the most important time of your day, where we go over our day, if anyone wants to get something changed, and then we see each other before we all get busy in our day. And then usually, I see about 10 to 12 restorative procedures, and that would be crowns, bridges, fillings, then recall exams and new patient exams, where we take x-rays, and then we diagnose and then treatment plan. Also, during the days, a few emergency exams where people, they just come in with pain, and then they need to be seen by a dentist. So that is basically a day for a general dentist. We also do hospital days, where we put patients under general anesthesia. So dentists, they get hospital privileges. So you just go to a local hospital, and then they put patients under general anesthesia, and then you just treat little kids that way, or patients with mental disabilities, where they cannot be seen in a dental office, in a dental clinic. So we do that in our clinic. We also have IV sedation. IV sedation is not a general anesthesia, but it is moderate sedation, where you get some drugs through IV, and then you just kind of are sleeping, but you're not on any ventilator, or you're breathing on your own. So that is for really, really nervous patients. You do that. We also have a nitrous laughing gas that pretty much every dental office have. So yeah, that is the typical day. When I started working, I used to work 5 to 6 days a week. I'm gonna take a break here to drink some water.
That's totally fine.
Sorry, that was the perfect time for my cough to have this morning. Anyways, so yeah, I started working 5 to 6 days a week, and then I had my son. He's 8 now. I'm still working 4 to 5 days a week. So, you being as a general dentist, you can kind of dictate your days. Excuse me. As long as you have that, in your contract, and then as long as, it's all in writing. So it all depends what you want to do. My future, I do want to start working, 3 to 4 days a week. And because my son is growing up, so I'm just taking care of him and stuff. So yeah, that's kind of a typical day. You know how I was talking about root canals in the back, how when we started school, when I was in the school, I just loved doing root canals, but not so much now. So sometimes I just refer my patients. Um, we do have specialists coming to our clinic. So we have a periodontist visiting, we have an oral surgeon who visits to our clinic, and we have a root canal specialist. So any complex cases, any difficult root canals, I just refer. I like to keep myself quite easygoing. I won't say I'm not ambitious. I just don't want to go into really difficult cases and then really difficult root canal, and it all depends on your personality. Some dentists, they really, they enjoy doing that. But keep myself easygoing, and I refer, and I just don't want that stress in my life, because being a dentist is very stressful, on your mental, on physically it's very demanding. You're in one small room all day, working on patients. Mentally it's very, very demanding as well, because most of the patients that come in with a negative perception of a dentist. So you have to change that too. I'm so sorry. So yeah, it's very demanding. So I like to keep myself, less stressful, by just referring the difficult patients to specialists. They're specialists, they know what they're doing, and just keep yourself stress-free is what I think. Okay, well, that's it. That was short. I think I talked very fast, but that, we'll get any questions if there is any questions, and that is my email address. That's my Instagram handle. Feel free to ask me anything. I was on a vacation this week, so I'm so sorry. I didn't have too much time to prepare for it. I kind of totally forgot about it too, but I did my best. I hope I have given you some good information, some knowledge about it. Feel free to contact me anytime on my email address, on my Instagram. I check my Instagram quite regularly, and my email as well. And then if you have any questions, let me know.
Thank you for the presentation. I love the advice. So yeah, we're gonna move on to the Q&A section now. So one of the questions I have is, you mentioned that right after the 12th year, you go into pursuing the dental degree in India. How was that transition?
So that transition is, after grade 12, you are kind of new in the world. But in India, the studies are very different than what they are in, what I feel in India. They put, there's lots of didactics, and then right in grade 1, grade 12 and grade 11, they kind of prep you for the pre-med or pre-dent. So the transition to right into a dental school or a medical school is actually not that difficult, because from grade 8, 9, 10, they kind of start prepping you towards that, because in grade 11 and 12, you have to choose your subjects. And then, you already chose if you want to go into medical field. So, so the transition was actually, it was not that difficult.
That's good that they prepare you ahead of time. So another question is that you had mentioned internships they can give you more dental experience for the application. Did you do an internship, and if so, could you speak a little bit more about that?
So the internship that I did was in India. It was after your 4 years of dental school, you do an internship that is included in the dental school. So it's not an option, you just have to do it. And that was mostly, all you do is you see patients, and you do all the procedures. You have to do like 2 months, you have to do crowns and bridges 2 months you have to do root canals. But the one that I was talking about was GPR. It's you just go into wherever you get that residency for GPR, and I did not do that. And as I said, that is what I would really recommend getting that done, because it will give you you go into a real clinical setting, and you are still not on your own, so you don't have to make your own decisions. There's still instructors who can guide you. That does give you more confidence. So if there's one thing that I would change, and if I could go back, is do that GPR. But it's it's done now, and I'm 9 years into practice, and so that's why I did recommend getting that done.
Okay, and then were you able to tour any dental schools like the one you chose before deciding? And if so, what factors would you advise one to look for when touring dental schools?
All right. So yes, I didn't mention in my slides there, but I had applied to quite a few dental schools, and I applied to UW in Seattle, to Boston University, USC, UCSF, and I actually got to get on tours of the dental schools there. And what you look for when you go on those tours is, again, you try to plan it ahead. So you talk to the advisor or whoever is handling your applications. You talk to them. You ask them that you want to meet with some dental students there, because that is what will prepare you the most. And I did actually get to talk to the dental students at all of these universities, and that actually made me, my decision to go into UW. And I was so blessed to go into UW that made my decision, final, that I had to do that. So talking to the current dental students, I would highly, highly recommend when you go on tours like that. And then you get to see the facilities. I would say every dental school, all of them have good facilities. When I went to all these dental schools, everything was, up to date. But you get to know the most from dental students there, because they are in there and they can advise you the best.
Yes, dental students would be a great resource. So another question is, what tips would you give a pre-dental student for shadowing to get the best experience?
Okay. So for shadowing, as I mentioned, you give your applications to the dental clinics where you're living. You give your applications, and then you tell them what you're looking for. For shadowing, I would suggest, spend as much time as you can. Now, I know most of us are working too, and I was working too. But if there is a chance that you can actually get to work in a dental clinic, being an assistant, or even sterilization, or just cleaning the rooms, or even just dental receptionist, whatever, just try to get as much clothes and as much experience in the dental clinic, and don't just limit yourself to one. I would recommend shadow at a few different dental clinics, because all of them are different. And then a few different clinical settings too. Go into a private clinic, go into a corporate clinic, a multi-specialist clinic if you can. Where I'm working, it's four dentists there, and it's a very busy clinic, so you can get an idea for what's coming ahead.
Thank you for that advice. It's good to get a perspective of every viewpoint.
Exactly.
Okay, so another question is, you had mentioned technologies in the dental field and how dental schools keep up with that. How does your office keep up with the rising technologies, and which is your favorite to use?
All right. So yeah, as I said, in our office, we do have the state-of-the-art, equipment. We have a CT scan in our office, where we can take CT scans for the implants, or even for root canals. I love taking CT scans for my root canals, because sometimes on the X-ray it just gives you a two-dimensional picture of a tooth and the root. But with a CT scan, you can actually see, sometimes the canals, they're just separating, or they're joining, or some hidden canals and stuff like that. So I would say in my clinic, my CT scan is my favorite. I use that all the time for my root canals, and I know the specialists who come to our clinic, they use it for root canals, for implants and everything. That is one of the most used tool in our clinic. We're soon getting a iTero scanner. That would be really life changing. With that, you just take impressions with the iTero, and so many other uses with iTero as well. So those are my favorite at my clinic.
Perfect. And then I was wondering if you did any mission trips in college or at dental school, and how was that experience if you did?
So yes, that is one thing that is on my bucket list. I have never done that. I know during my dental school, I was given the opportunity and I really wanted to do it. I had some family emergency and I had to go back to India at the same time. So yes, that is one thing I missed in dental school. And after that, I never got a chance, but that is on my bucket list. So hopefully soon I'll get to do it.
But even though you didn't get to do a mission trip, you still got to experience the dental field in India, Canada, and the US. So I
That
was
is true.
wondering, yeah, very traveling. So I was wondering how those dental fields compare in the different parts.
There is, as I said, in India, I was in a dental school, where I didn't get to practice except for my 1 year internship that I did. And then in here, I would say in dentistry is pretty much the same in North America and in India. One thing that I noticed is different is the patient management. I really, really got to, learn the patient management when I moved here, to US and in Canada. US and Canada, I think, pretty much are the same, except for, as I said, I have no experience with corporations in US. I have heard not good things about corporations in US as well. So that is the management aspect, but the clinical, patient management was different, which I get to know the psychology part of the education, where you get to actually know the patient, the why, what we're doing, is different than in India. In India, I just did an internship for 1 year. So again, I didn't have much experience, but that is what I had not learned in India, is the actual patient management, which I got to learn here. So very thankful for that.
Okay, and now transitioning back to dental school, what is something you wished you knew before going into dental school?
So before I went into the dental school, so in India, as I said, it was just a direct transition. There was not much of a change. What I would recommend is, what I had done different or known different is actually taking a gap year before my school. I thought, and getting more experience into like public health and into volunteering and stuff, because after you're out of dental school, you don't get to do those things as much. So that is one thing, just taking a gap year, just taking a break from studies is what I would recommend, because I just went straight through all of that, and is what I would recommend I had done.
Yeah, it's definitely a lot of years of studying.
Yeah.
And did you have a favorite class or subject in dental school? I know you mentioned your favorite procedure was root canals.
Yeah. So in my dental school, root canals and oral surgery was my favorite. I loved, again, even to this point, that is, as I said, I wanted to be an endodontist or thought of doing that. And then oral surgery was another thing that I was really, really interested in. So those were my favorite. But as I said, I just love, doing everything in dentistry. If I try to think and see what I don't like doing, I just don't have. Yes, I don't like doing scaling. Yeah, I do have one. I do not like doing that. But other than that, I just love doing everything else. It just gives a variety. I'm a person where I cannot, I need to have a variety of, of things. I cannot just do one single thing, same thing all day. So yeah, pretty much everything is my favorite, but those two were most favorite.
Yeah, like you said, general dentist is like the best of all worlds. You get to do everything.
Exactly. Yeah.
And then another question is, why did you choose to practice in Canada specifically?
All right. So as I said, when I moved from India, I came to Canada. That's where my husband lives. So so we lived in Canada. So that is why going to a dental school, I had researched, and I was really intrigued with the University of Washington in Seattle. And then I looked at all of the other schools as well. And then going to school there and then coming back to Canada wasn't that much of a long process. So that is why I chose to go to University of Washington. And then I knew I always, all my families here, so I always, had to come to Canada. So that was my home.
And you also had mentioned CE courses. Could you explain a little bit more what those are?
All right. So CE courses are continuing education courses. Over the time, whether you're a dentist or dental assistant or a dental hygienist, you need to be, because dentistry is ever changing, every year it changes. So you need to stay on top of, all of the new changes. So these are mandatory as well in Canada. They're mandatory, and I'm pretty sure in US they're mandatory too. So we have to do, in Canada, we have to do 90 hours of continuing education over a period of 3 years. So as I said, with the corporation, they always come up with these networking courses where you get to, meet with other dentists, and also the continuing education. Then you get those credits for, you can do some online continuing education. I always prefer combining my continuing education courses with a vacation. I do, I recently, we went to, through UBC, we went to Maui. It was a CE course for 4 days, and then you combine it with, you take your family with you, and then you combine it. It also, for your tax and stuff, you get a vacation, and then you get to write off some credits, write off some tax, the money that you're actually spending on a CE course. So yeah, that's a good way to do it, and I always like to do that.
That's very cool that you can travel. So
Yeah.
another question is, you said that school life it's different than the real practice. So could you explain a little more about those changes and the transition into the workforce?
Okay. So yes. School life is very different than the real life. Even in your school life, I remember doing my first class 1 occlusal amalgam filling for it took me 3 hours to do one class 1 occlusal amalgam filling. That was my first one, and my instructor was like, "What are you doing in there?" I'm like, "I'm doing a filling. I don't know. It's taking me that long." And towards your 3rd year, your 4th year, you're so fast, and you know now I'm in for an occlusal filling. I do it without even thinking. So in school, even in school, it's very different from your 1st year to 4th year. But after you come out into a real practice, I remember my first few days, I was so used to showing my work to the instructor after everything. After I finished my root canal, in school, I had to get grades on that, and the instructor would come over and check it and tell me if I did it right or wrong. But when you're out in the real life, you do your filling, and then there's nobody to check it. You're like, okay, that's it. And first few days, I remember the owner practice, I would call him and I'm like, "Can you look at it?" And he's like, "No, you don't need me to look at it. It's good." So you learn with experience in real life, and there's nobody to tell you what to do. You just have to follow, what you have learned in school. And then there is so much more, as I said, patient management in real life. In dental school, you don't get to experience that. Patient comes in and you do a filling on them. In real life, you have to tell the patient why they need a filling. Just as a simple thing as a crown, you have to tell them why they need it. You have to justify it to them. Then the patient has to actually book it. They actually have to buy into your treatment plan. So there's so much more patient management, how you communicate with the patients, how you communicate with your staff. That is more the clinical part. Doing the fillings, doing the crowns is one thing. You will get experienced, and then that will be the easy part. The hard part will be managing everything else around you, the staff and the patients.
Yeah, the training wheels come off after dental school.
Exactly.
You had also mentioned briefly how COVID impacted the dental experience in the clinic, that there were a little bit less patients. Were there any other changes of how COVID impacted the dental field? And for example, did it affect more patients being more anxious because they already have the negative stigma going to the dentist? Did it make it worse?
Yes. So as I said, that COVID impacted dentistry quite a bit. As you just mentioned, patients are already, they perceive us as not a very positive environment, with needles and everything. So they already have this negative perception. With COVID, I would say with the infection control part, patients were not that scared of it because they have seen us already following all the infection control procedures. We're always in our masks and gloves and the cleaning and the sterilization. I think that way dentistry, dental fields was really lucky because we're already following all the infection control procedures. So I think for the patients, it wasn't actually going into the clinic. It was just mostly getting out of their house is what they were mostly, they just didn't want to go anywhere. So it was not particularly just for the dental clinic, because I talked to many patients and most of them, they are not worried about infections in the dental clinics because some of the patients even told me that, they actually, if they want to go somewhere, dental clinic would wait because you guys already follow so many infection control procedures and, everything is so clean here. And so I think it impacted mostly because people were just scared to go anywhere. So that's how it affected. And plus, loss of jobs and then, less money available for dental treatments that impacted the dental community a lot, but it's getting better now.
That's good to hear, and it's good to hear that they didn't have more fear of going to the dentist.
Yeah.
So, for the last question, this is kind of creative, but if there's anything in the dental field that you could change, what would it be?
All right. If there is anything that I would change in the dental field, is I would recommend. I would think that how more communication, because I think dentistry is a very unless you're working in a clinic where there is like 10 dentists working together, most of the time you're just working by yourself. It is a very, very lonely job. And, that is what I really think should change, like more of the multi-dentist practices where, where you communicate more and more networking, more socializing, because it gets to you when you're just by yourself, and then you're kind of the boss for, for the assistants, and, so it's kind of very lonely. So that is what, something I wish that I was lucky that I'm working at in a clinic where there's like 4 other dentists and they keep changing. I'm the one who's always been there. Yeah, more like multi-dentist clinics.
Yeah, that sounds interesting because then you can consult each other for the cases and everything.
Exactly. Yeah.
So I wanted to thank you for your time and for coming to share your experience with us and all the advice. It was very
Thank you. You're welcome. Thank you so much. I hope I helped a little bit because, it is very new to me and I was very nervous, but I hope I did help a little bit. So thank you for inviting me.
You did great.
Thank you.
Thank you.